Hello, I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers, and today we're uncovering something that most people never hear about. The 10 causes of neuropathy you might not know about. We see patients every week who have nerve pain, tingling, or numbness and don't have diabetes, and they have no idea it's from something else entirely. If you've ever wondered, why do I have neuropathy? This video is for you. Over the next 10 minutes, we'll reveal these hidden causes, explain how they damage your nerves, and give you real steps to protect yourself. For more, check out our videos, Why Neuropathy Symptoms Worsen at Night, linked below, and grab my free guide, 5 Things You Can Do Today to Help Your Neuropathy, or book a consult with us. Stay with us. This could be the missing piece to your nerve health. Before we dive in, some lawyer talk. Please consult a healthcare professional for any issues you may have. This is not personal healthcare advice and is for informational purposes only. Let's start with the truth. Neuropathy isn't just one disease, it's a symptom of nerve damage, and that damage can come from surprising places. Your peripheral nerves are like electrical wires running from your brain to your hands, feet, and organs. When they're damaged, you get static, tingling, numbness, burning, or even weakness. Diabetes is the loudest cause, but it's only part of the story. The rest, that's what we're unpacking today. To be upfront, not every case fits the textbook, but knowing these causes can help you catch it early. Let's jump in to cause number 1. Shingles, or Postherpetic neuralgia. This is the most painful and overlooked. The varicella zoster virus, the same one that causes chickenpox, hides in your nerve roots for decades. When it reactivates as shingles, it inflames the nerve and in 1 out of 5 cases leaves behind postherpetic neuralgia, a burning, stabbing, electric shock pain that can last months or years. This is an interesting one because it can be one-sided, which neuropathy typically isn't, and confused with a disc herniation in the early stages until the blisters come. Earlier in my career, I made this mistake once. Class 4 medical cold laser is a great for acute pain relief and then immune support treatments. Cause number 2, chemotherapy, or chemo-induced peripheral neuropathy. This one breaks my heart. Chemo drugs can be lifesavers, but they're also neurotoxic. They damage the microtubules and nerve cells, causing glove and stocking neuropathy, numbness, tingling, and burning starting in the fingers and toes. Up to 70% of patients on certain regimens develop it, and for some, it's permanent. In my experience, most chemotherapy-induced neuropathy goes away within 6 months, but if it's still there at 12 months, it's there to stay. While many oncologists will try to adjust the dose to minimize this, they're in a tough position. If they don't give enough, the chemo can't do its work. Chemotherapy is the second most common cause of neuropathy we treat. Check out Michael's testimonial below. Make sure you watch it up until what his brother said about him starting care. Cause number 3, Lyme disease. This is a silent epidemic. The Borrelia burgdorferi bacteria from a tick bite can invade your nervous system, causing neuroborreliosis, facial palsy, shooting pains, numbness, or even meningitis-like symptoms. In chronic cases, it triggers small fiber neuropathy with burning feet and autonomic issues. Spend a lot of time in wood areas, ever notice a bullseye rash? You need to talk to your provider. Could this be Lyme, especially with joint pain, fatigue, or a bullseye rash history? Demand a 2-tier test, ELISA plus Western blot. Don't accept negative from a single test. Cause number 4, autoimmune diseases, Guillain-Barré, Lupus, Toxins, chronic inflammatory demyelinating polyneuropathy, or CIDP. Your immune system can turn on your own nerves. In Guillain-Barré, it's rapid weakness. Patients go from walking to paralyzed very fast. In lupus or Toxins, it's tingling, dryness, and fatigue. CIDP mimics MS with progressive numbness. Our shockwave therapy to improve the symptoms and anti-inflammatory protocol to improve health. Ask, could this be autoimmune, especially with rashes, joint pain, or fatigue? Blood tests for ANA or anti-SSA are essential. Cause number 5, chronic alcohol use. Alcohol is a direct neurotoxin. It damages nerve axons and blocks thiamine absorption, causing alcoholic neuropathy. Symptoms: burning feet, leg cramps, balance loss, and even confusion. Heavy drinkers can lose sensation in a stocking pattern. this is a tough one to help with because while the damage is actually easy to treat, you have to stop drinking alcohol. I've had patients that wanted to start care but refused to stop drinking, and we couldn't accept them into our program. If you or someone you care about is struggling with alcohol, please seek help. Cause number 6, infections beyond Lyme. Viruses like Hepatitis C can trigger cryoglobulinemia, immune complexes that clog small blood vessels, starving nerves. Symptoms: purple toes, leg pain, weakness. We had a patient with cold purple feet diagnosed with Hep C after a blood donation. While our therapy to improve is key, appropriate antivirals must also be used. Ask, could a viral infection be the cause, especially with liver issues or IV drug history? Antibody tests are key. Cause number 7, toxins and heavy metals, lead, mercury, arsenic. Environmental poisons are silent nerve killers. Lead damages motor nerves, so wrist drop. Mercury causes sensory loss and tremors. Arsenic mimics B12 deficiency. We're outside of Chicago here, and believe it or not, lead in the pipes is still a concern. If you have amalgam fillings, you may want to speak with a biological dentist as well. Your occupational and environmental exposure can be an issue as well. Construction, painting, or contaminated water. Hair, urine, or blood metal tests can confirm. Cause number 8, hypothyroidism. Low thyroid hormone slows nerve conduction. Patients get tingling, cold extremities, brain fog, and muscle cramps. Not to mention weight gain and low energy. Poorly optimized thyroid function can be the root cause of a number of health issues. Don't accept normal TSH. Ask for free T4, free T3, reverse T3, and antibodies. Functional ranges matter. Cause number 9, HIV-related neuropathy. HIV and its treatment can cause distal sensory polyneuropathy, DSP, burning feet, numbness, and pain in 30 to 50% of patients. The virus itself and drugs used to treat it can damage mitochondria and nerves. We've seen a number of patients suffering from neuropathy as a result of HIV and its treatments, some from as long ago as the 1990s. Cause number 10, idiopathic, unknown. Sometimes we can't find the trigger. It's idiopathic, a fancy way of saying we don't know. But that doesn't mean hopeless. We've had patients with no clear history of what caused their neuropathy. However, if thermography shows decreased blood flow and pseudoscan shows small fiber damage, our non-invasive protocol, laser, shockwave, neurobiofeedback, nutrition, has been able to show excellent results. Ask, even if we don't know the cause, what can we do? Focus on function. Pseudoscan and thermography can still guide treatment. There you have it, the 10 causes of neuropathy you might not know about it, from shingles to idiopathic. Again, a fancy way of saying we don't know. These aren't rare, they're just underdiagnosed. If any sound familiar, don't wait. Start a symptom journal. Ask your doctor these questions and get tested. At Innovative Nerve and Joint Centers, we use pseudoscan, laser therapy, neurobiofeedback, and root cause care to help patients like Dawn walk again. For more, subscribe, share this video, and download your free guide below. If you're ready to find your cause and get real relief, share your story below or contact us today. Stay proactive, stay informed, and we'll see you next time. Start taking steps today to take steps tomorrow.